If you had to convince me that obesity is a disease, could you list a few things that back up your claim? If you are obese in terms of BMI, but it's not actually harming you, then can you be diseased?
I don't have better willpower than you. I have different biology. Obesity is a disease of excess body fat that then can impair health. So the first thing to do is see where is your excess fat and how is it impacting on your health.
Hello and welcome to Health Wealth, a podcast that initially started as a way to bring to you simple, accurate, and motivating advice for your health. But something that human beings are great at is evolving, and so we did 94 episodes of the former version, and now we're at the beginning of season 2. And we have with us a new producer, Prateek, Lidhoo, who has brought in some changes, so I get to talk more. I am no longer going to be surrounded by red walls that look like a Chinese gambling den, and I get a teleprompter. So altogether, there's going to be a whole lot of more opportunities for me to bring to you the most reliable, the most experienced people in various fields who would be able to provide perspective, if not give you a solution to some of the greatest challenges that face your well-being and mine today. Why do we hold our stomachs in? It's not comfortable. Sometimes it doesn't even fool anyone, especially when your genes are straining at the posterior anyway. But we still do it. I don't know about others, but I can speak for myself that I do it to avoid the following statements from well-meaning friends and family. You should exercise. Don't eat sugar. Are you pregnant? And it doesn't feel nice to be nagged and advised about weight because, trust me, nobody really wishes this upon themselves. Extra fat is extra baggage that you have to carry around all the time. So it should be great news that being fat is no longer being viewed as a result of greed, generational laziness, stress, weakness, but it is in fact getting to be known as a disease. More specifically, it is a heritable neurobehavioral disorder that causes dietary intake dysregulation. Now, there's a line to quote to your parents when they don't let you eat pizza. Over time, our bodies have evolved to regulate something called dietary homeostasis, and it keeps it at a level that's best for our survival and reproduction. Dietary homeostasis is essentially how much we should be eating based on how much energy we need in our bodies. And when this goes for a toss, that excess energy that we're eating, it starts getting stored as fat or adipose tissue. And now here's the weird bit. This fat was actually selected by evolution for us as emergency energy. So fat in our bodies is not a bad thing. It's there for our survival. But now research is finding that fat isn't just a passive storage deposit of energy, but it's actually an organ by itself, and it regulates and produces hormones, especially two very important hormones, leptin and adiponectin, which sounds like a couple, but they're actually hormones. Leptin helps regulate our energy balance, our appetite, our body weight. It actually tells our brain that, look, we have enough fat storage, you don't need to eat more. And adiponectin, that helps in regulating blood glucose and our fatty acid metabolism. It actually helps prevent diabetes, and it blocks that horrible thing that I always associate with the COVID-19 pandemic, also known as internal inflammation, which is very, very bad for our health. But research is showing that these hormonal mechanisms of fat starts becoming dysfunctional after a certain amount of fat gets deposited in your body. And that dysfunction actually causes you to overeat. But the trigger for overeating is not the fat or the adipose tissue. It is that first tendency to start overeating or overconsuming calories. And that tendency isn't something you comes from your personality. It actually can be because of what you've inherited. So there are studies which have estimated obesity to be a heritable disease, and the likelihood of this to be anywhere between 40 to 70%. Wow, I really have things to say to my parents one day. The tendency is also driven by changes in our food environment. We don't hunt for food anymore. We hunt for digital menus now, sitting at our desks and drinking karak chai with full cream. And so when food becomes so readily accessible, we do have a tendency to overeat. And there's research to show that it's not just the amount we're eating, but also what we're eating. So there is a very interesting model called the carbohydrate insulin model. And this says that there are certain hormonal changes that happen in our body when we eat highly processed carbohydrates. And what this does is that it starts to deposit the calories we're eating into fatty tissue and leaving less for our bodies to use in our day-to-day needs. So I need energy just to sit here and talk to you. But the oatmeal bar I ate has probably already been turned into fat deposits. So I'm going to want to eat something more, which I actually do, but I won't. But here's this cycle of overeating and getting fat, and that fat in turn makes me want to overeat. So a number of global health organizations now say that obesity is a disease because it's out of your control and it causes dysfunctions in your body's functioning. They also say that it needs to be treated with medicine and with clinical care. But what medicine? Remember, I told you more about those hormones that fatty tissues produce and how it helps regulate your appetite. Well, in people with obesity, this adipose tissue doesn't work very well. And so drugs have been created that will help regulate our appetite in the same way that fatty tissue or gut hormones would be doing so. These medicines leave you feeling satiated right after you've consumed the exact number of calories you need to lose weight. In a very strange way, they actually work as a calorie restrictive diet would, except you wouldn't be needing your willpower. The drug would be doing that for you. One such drug, Eli Lilly's Mounjaro injectable, is now available in India. And there are talks that very, very soon we'll be having another much talked about medicine called Ozempic, which is produced by Novo Nordisk, and it would be in India very soon. So all of it sounds great. I'm diseased and the treatment for my disease is here. But is that enough? Let's find out through a conversation with Professor Rachel Batterham. She is currently the Senior Vice President of International Medical Affairs at Eli Lilly. She was the former professor of obesity, diabetes, and endocrinology at the University College of London. And when she was there, she also helped establish a bariatric center for weight management and metabolic surgery. You've been studying and working with obesity and patients with obesity.
Thank you.
For a long time. If you had to convince me that obesity is a disease, could you list a few things that back up your claim?
So nobody chooses to develop obesity. There are multiple causes and not one person gets there by the same route. But when you've developed obesity, your biology changes. Your hormones that come from your gastrointestinal tract and tell your brain that you've eaten, they change. When we do brain imaging studies using specialized imaging, the way the brain of the person with obesity responds to food completely changes, and the connections in the brain. And then when a person tries to lose weight, their body does everything possible to make them put the weight back on. And this is because if you think about evolution, why would we stop eating? All of our systems in our body are set up to make us eat when food is available, because otherwise we would have died out during starvation. So when a person loses weight, and everybody who tries to lose weight sort of goes through this cycle. So they do what you were saying, they starve themselves, they go on a diet of some description. They're really happy because they've lost 10, 15 kilos. But then despite their best efforts, they put the weight back on. And that's biology. As soon as you go on a diet, all of your hormones change to make you hungry, to drive you to eat more. Plus also your energy expenditure goes down. So your body does absolutely everything to take your weight up to the highest weight that you've ever been. So what happens is people lose weight, then they go higher, but they actually overshoot and end up higher still. And that we understand the science that drives that. It's very clear. It's not willpower. I don't have better willpower than you. I have different biology.
I read this very interesting study which actually pointed out, what you're saying, that you have a different biology. In this environment of overconsumption or, alluring advertisements for Biscoff cheesecake, I can't resist it, but you can.
Yes.
And that really did impact me a lot on a personal level. So if I walk up to somebody and I say, I think I might have a disease, I think I might be a person with obesity, they're actually going to laugh and say, oh, it's all in your mind. You've been, reading too much of news, or you just want a shortcut way to lose weight. But I believe I would qualify for that, having been, 88 kilos and gone down to 52 kilos and gone up to 64 kilos. So I believe I would qualify for that. So a lot of the way in which we would classify somebody with obesity as a dysfunctional disease is based on the appearance. Are there better mechanisms of diagnosing obesity as a harmful disease?
So you've already alluded to the fact that the way we diagnose obesity is flawed a little bit. So we start off with body mass index. And that's great if you're looking at a population level, but at the level of the individual, it doesn't really tell me anything about your risk. So obesity is a disease of excess body fat that then can impair health. So the first thing to do is see, where is your excess fat and how is it impacting on your health? So that's why measuring waist circumference or waist to hip circumference is also important. But then what a physician would do is then look at all the areas of your health where obesity might impact on it. So, for example, cardiovascular system, your liver, your joints, but also thinking more broadly, so your psychological and emotional health are also impacted. So obesity can cause over 200 complications. So when a physician sees somebody with obesity, they're looking to see how the excess adipose tissue is impacting on their health. Because in some people it might not be at that moment in time.
Yeah.
And that's the difference between obesity being a risk factor and a person having obesity, the disease. When it's impairing your health, then it's a disease in its own right. Yeah. Whereas when it's not doing that, then it's a risk factor for other diseases.
Yeah. I've just, so that we have a fair argument here, I have been reading up on the counter view to this. And there is one article I came across by an epidemiologist at the Albert Einstein College of Medicine, Jeffrey Kabat. And he believes that the best medicine to treat obesity is culture and lifestyle and the environment. It's all about willpower, according to him. And it's all about us as human beings using our feet and our forks in the right way and so on. And that when you start talking too much about obesity as a disease, you start focusing more on medical treatments, clinical treatments, and you're going to take away from the preventive aspects of obesity. Would you agree with that?
I completely disagree. So prevention is really critical for obesity. Any child born today doesn't need to develop obesity, and that's prevention. And we can do a huge amount in our environment with our food systems, exercise, built environments to prevent. But for the people that already have the disease of obesity, there's more than 1 billion people globally. Those people deserve to be diagnosed and access to holistic treatment. So including advice on lifestyle, access to obesity management medications if they need it, or even access to metabolic bariatric surgery. So prevention doesn't mean you don't do treatment, and just because we say obesity is a disease doesn't mean that we wouldn't prevent it. In fact, I think it would make it sort of more important.
Do you think sometimes the mental health aspect of obesity needs to also be worked alongside going to, your endocrinologist or your bariatric surgeon?
Yes, but also because people living with obesity experience a lot of stigma. Stigma from society, because people think, well, why can't you just eat less, move more? And also they stigmatize themselves. They blame themselves. That voice in their head saying, if only you tried a bit harder, if only you hadn't eaten that Biscoff cheesecake. So the psychological, being kind to yourself, and what we call food noise is really important to address. It's not just thinking about what you're eating, your physical activity. It's also thinking about your sort of psychological well-being, stress, sleep, and other aspects of our life that we just tend to forget.
Yeah. In fact, I have this ongoing argument with my family where I keep telling them, can we not revolve everything around food?
The problem is so cultural.
It's so deep-seated, There are people who would get offended because I will carry my own food with me. And I keep telling them, this is not food, it's fuel.
Yeah.
Stop taking it socially when I'm just trying to, look after myself biologically. And do you want me to be ill then? But it is so hard to break. Do you think it'll ever get broken?
I think it will. And I think we're starting to see it, probably not in India, but the awareness that actually obesity impacts on your health and what you eat is really important. So there's a lot of media attention, in particular in the UK, to do with ultra-processed food and other types of food stuff. And people are really looking at going back to more sort of minimally processed foods and really thinking about what they're putting in their bodies and how much. And one of the really useful ways is actually if you put how much exercise you need to do for consuming something, for example. So one slice of pizza, you need to walk for 1 hour and 10 minutes. And I think that helps people put it into context, because often just saying that something's 300 calories doesn't mean anything.
No, it doesn't.
But it's also the quality of the food that you're eating that's important rather than just...
Yeah, no, I've been doing this new thing where I'm breaking up. Earlier I used to make my diet based on what I would eat. Now it's based on macronutrients. So then I'm not constantly visualizing, my salad and then thinking about it, and then I get hungry and then I'll end up eating a lot more. And as you said, I don't blame myself so much anymore. And there's a very, very interesting line I came across in an interview of yours where you said that the first thing you say to a patient is let them know that their weight is not their fault. Are there any reactions to that statement which you could share, which, might have just stayed with you throughout your career?
I would say that in my average clinic, at least 2 of my patients would cry when I'd say to them it wasn't their fault. And I'd explain the biology we now know drives some people to develop obesity and other people to stay thin. And in particular, the biology of weight regain once you've lost weight. Because often people feel the worst when they do that, because their family and friends are like, how could you put that weight back on? How could you do that? And the shame of weight regain for many people is so bad. And just often they've been particularly stigmatized by healthcare professionals. They will have seen doctors over the course of their life for other things, and everything will be blamed on their weight and it will be blamed on them. So doctors and understanding that obesity is a disease is really important, because if your first interaction with a doctor to do with your weight is a stigmatizing one, you won't go back. So that's where we really need to change things, and people need to be diagnosed and then given support and treatment. But the thing is, obesity isn't a one and done. And that's one of the misconceptions at the moment, that you can take a course of treatment and then it's done. It's not. It's like having high blood pressure. When you have high blood pressure, you take a medication, your blood pressure comes down, you have treated high blood pressure. If you stop the treatment, then your high blood pressure goes back up. And the same is true with obesity, because we're not curing obesity, we're treating it. And that's one of the biggest messages, that as we now have treatments, that people don't think that this is like a course of antibiotics. This is a lifelong disease that needs the same sort of holistic care as other diseases.
In the Hmong culture, which is from East and Southeast Asia, epilepsy is not considered a disease at all, but it's seen as a spiritual gift. And in the rest of the world, we consider it to be a disease worthy of clinical treatment. Very important for us to then understand that being fat isn't a disease, it's obesity that's the disease. And the reason is that when you are fat, you are referring to a body size or something that's measured by that awful thing called BMI. And I remember when BMI first took off, it was like a thing to wear with pride, you know. It was the same as, it was a predecessor, in fact, to size 0, where, you know, you'd feel so happy if you were of normal BMI. But today, there is a lot of research saying that just because you might not have a normal BMI does not mean you're physiologically obese or that you have the disease of obesity. If you are obese in terms of BMI, but it's not actually harming you, then can you be diseased? This year, in the Lancet Journal of Diabetes and Endocrinology, a team of more than 50 doctors from around the world has researched and concluded that not all obesity can be called a disease. And it argues very strongly that doctors and people like you and I should classify people with obesity into 2 categories. Those who have clinical obesity, whose weight is actually causing health problems, and those with preclinical obesity who are otherwise healthy. And that healthiness of their bodies can be based on blood tests and various other clinical assessments that only your doctors can make. I really like this part of the report which says, look at where the fat is. Don't just look at BMI numbers, because someone with a normal BMI could just have an excessive accumulation fat in the belly or the abdomen, as doctors like to call it. And we do know that that belly fat is more harmful than fat accumulation anywhere else. So we learned 2 things already. Calling obesity a disease does improve access to treatment and helps those who need it. Not all obesity can be called a disease. But there's one last thing to consider. How do we prevent all obesity? Because if we are to win the war against it, it shouldn't be there in the first place. And that's where environment matters. If calling obesity a disease makes us treat the condition with more respect and those who have it with more compassion, and if it directs more resources to the provision of skill power to adults and children, then it's for the good. But if, as I predict, it causes us to think more about pharmacotherapy and less about opportunities to make better use of our feet and our forks, it will do net harm. I recently came across a very beautiful thing that happens in Japan, and it's called the death experience, where you are taken to a cemetery and you are asked to die and you're reborn again. And once they put you into a coffin and they nail you in and they open the coffin again, you're asked this question that if you had to restart your life, what's the one change you would do? And when I was watching it, I really looked back at my own life and I said, I wish I hadn't overeaten on those burgers and pizzas and ice creams when I was 17 and I failed my exams and I was very stressed, because that started in me a chronic condition that's never ever left me. It's changed my body for life. And more than anything, I think if we are to win this war against obesity, we need to tell more people that don't get fat in the first place, make the right choices nutritionally, because unfortunately, it's very unlikely we'll be reborn in the same bodies. What are your views on calling obesity a disease? You can share them with us at pods@indiatoday.com, or you can write to us at 8588966996. And if you've enjoyed this episode, then please do rate us. We are available on Apple, Spotify, YouTube Music, and the India Today website.